Research is showing some promising effects of using perineal massage as a tool before pregnancy to try and reduce the risk or the severity of tears that you can have. So your perineum is going to be the space and tissue right in between the vaginal opening and then the anal region here. So this tissue right in between is your perineum. And this is what we're using a tool to help mobilize and get your body used to the sensation of stretch and to reduce that risk of a severe tear. So your tears are most commonly happening down in this bottom portion. I like to think of this as a little letter U, so down in this area right here. You're going to take your tool. I like to use the Intimate Rose pelvic wand, and the reason for that is because the tip of this is shaped like a finger, but it's just a tool that you can use to help mobilize and stretch the tissue. So I'm just going to remove this for the demonstration purpose, but you're going to take this tool with just a little bit of a lubricant, and you're going to place this in slightly into the vaginal opening. Your force is going to be down towards that perineal space. So you're using some gentle force to pull down, holding about 10 to 15 seconds while we focus on our deep breathing, and then go ahead and relax. You can then mobilize a little bit to one side, holding again 10 to 15 seconds using our breath work here. And you can work your way down into this U shape. So if this was a clock, this would be between 9 o'clock, 6 o'clock, and 3 o'clock. So anywhere in that bottom space is a great spot to be focusing on your perineal massage. If you're not using a tool like this, you can use a clean or gloved finger to do the same thing, where you insert vaginally and then you pull down on that tissue there. So the whole focus of this is to get your body used to the sensation of stretch and to calm the nervous system to know that stretch is not something that we need to tense and guard around. When you perform this technique, one of the best places to do this is either on your back. So we can go on our back, and you're going to use this tool to reach around behind, because remember, you will have the big belly here. The other thing you can do is a supported position where your back is up against the headboard, and now we're in this reclined position and you can reach around either direction a little bit easier. Or I have some of my clients who do this in the bathtub where their back is supported and they're reaching around using the pelvic wand as a tool to do their massage. Now this technique, the research is supporting starting around 34 weeks. I like to recommend at 32 weeks. But this is a great opportunity to use something to your advantage to help reduce those risk of tears, reduce potentially the severity of tears, and to prep your body for a vaginal delivery.